When starting the central line, the first thing that we will do is do a thorough chart review of the patient. We're checking for any abnormal coags, any allergies, as well as consents. Once we check our patient's chart, we want to make sure that we have all the necessary equipment, including the ultrasound, our central line kit, and then we will make sure that the patient is in position and hooked up to, at the least, SpO2 and EKG monitors. So once we have our patient in position, we can go ahead and, while we're unsterile, we'll wash our hands, have regular gloves, get the ultrasound, and we will assess our patient's anatomy. So using the ultrasound, we want to make sure and find both the artery and the vein. So we're looking for the right IJ. We'll also see the right carotid here. To ensure that we are looking at the right vessel, we will use compression. So we'll compress the artery, see the pulsation, and then we'll move over to the IJ, compress, make sure that it is compressible, and that we are in the right vessel, or we're looking at the right vessel. Once we've assessed our anatomy, we can, let's see here, we will clean, sterilely prep the patient. So using the ChloraPrep, we're gonna start from the inside, make circular motions out. Once we've cleaned, we will allow that to dry for at least 3 minutes. And we will go ahead and get into our sterile gown. So make sure our sterile gloves are open. I would have an assistant put me in the bag. Now that we are sterile, we will place our drape. Good. This would be on a separate table, allowing for our drape to be placed. Now that we're draped, we are going to have an assistant help us get our ultrasound probe also draped and sterile. And we will take the sterile ultrasound probe from or have that get sterile. We can have it here. And then we will set up our kit. if the patient is awake, we have lidocaine that we can draw up for local, for skin local. And then the big thing here is making sure our guide wire works properly, it slides appropriately, and we want to make sure that the tip of the guide wire is within the introducer. At this point, we could also have, if we don't have sterile flushes, have an assistant place sterile flushes on our field, we would then use the sterile flushes to flush our caps and have them ready, have the caps ready. So since this patient is already anesthetized, we will not be using the lidocaine. So we'll take the sterile probe, again, find our IJ. So once we have identified our anatomy, we will take our needle and with the bevel up, we're going introduce, and we're applying negative pressure as we advance the needle until we have blood return. So now that I have blood return, I will drop my ultrasound probe. While I'm holding the needle, I'm going to disconnect the syringe. I will now have blood return coming from this needle. Again, make sure our guide wire is within the introducer. We will now thread the guide wire through. As we're threading the guide wire, we want to make sure we don't meet any resistance, and we're also looking at the EKG to check for any ectopy. Okay, now that our guide wire is in, we'll hold both the needle and the guide wire. Take this out, and now while we are holding the guide wire, we can take the needle, remove the needle. Now that the needle is removed, we will take our scalpel to make a small incision for the dilator. And then we will slip the dilator over the guide wire. And then in one smooth insertion, we're going to go in and out to dilate the skin. Once the skin is dilated, we can take our catheter. We want to make sure that the brown port is uncapped to allow for the guide wire to come through, and the additional ports are capped. And we are checking for our guide wire should come out the brown port. Okay, so now that we have our guide wire out of our brown port, we'll use a push-pull method to thread our catheter in. We'll remove our guide wire, and then using our sterile flush, we'll connect, aspirate, make sure we have blood return, flush, cap, and then follow suit with the additional ports. We want to aspirate, make sure we have blood return, flush with sterile saline. Once our placement has been verified, we will suture into place. We can take our drape off, and then we would place a sterile Tegaderm on top. And then we would just ensure if this patient was on the floor or like not in the OR, we would make sure that we have a chest x-ray ordered to verify placement.